Lisa, I'm going to switch off your camera. Right. Okay, good afternoon. Thank you, Dr. Muhilan, for joining us here today. Thank you for joining Global Health. So to all of our audience and all of our attendees, Dr. Muhilan is a consultant urologist and male fertility specialist at TMC Fertility. And he will be discussing with us today the different types of male infertility. As we all know now, infertility is not a women only problem, right? And it is also a problem that a lot of males are facing at this time. So we are here to kind of break the barriers and open the door for discussion in terms of male infertility. This is our series number 2. Our previous infertility webinar was a general infertility, and today we will be focusing on all male infertility issues. So Dr. Muhilan, thank you so much for joining us.
Okay, good morning, Jisoo. Or good afternoon. Sorry, good afternoon, Jisoo.
So what, Dr. Muhilan, I'll switch off my camera and the floor is all yours, and I'll jump right back in once you are done.
All right, thank you so much.
Of course, my pleasure.
So good afternoon again. So, when most guys or when you get referred to me for infertility, there's usually someone has suspected a problem with your sperm, and the problem can be multiple. Either you are not producing any semen or you are producing semen, but there's a problem with the sperm. So put it simply, the first thing we have to do is find out what exactly is wrong. So we check your sperm, and in general, you either have no sperm or you have sperm which are very low quality, very low numbers, or they're not moving. Keep it simple. There's either problem with the sperm quality or you have no sperm. To confirm what you have, we then do some basic blood tests, and among them is FSH, LH, which are the control hormones. They tell the testis what to do. So if they are working well, they will tell the body to produce more or less hormone, more or less sperms, and testosterone, your all-important male hormone that controls sperm production. So that's a simplified version. Now, the results will come back many things, but one of the most scary things, the ones that the gynecologist cannot do anything with, is if you come back with azospermia, where you have zero sperm. Now, if you have zero sperm, there are two reasons. Either the factories in the testis called the Sertoli cells, they don't produce sperm, or they're producing insufficient sperm, or the sperms are in such low numbers you can't find it, or they're producing good sperm, but the pipes are blocked. So all the sperms are trapped in the testis. So that's called obstructive azo. So we'll start off with the scary one. What happens if you are not producing sperm? Now, if you are not producing sperm, classically, when we check, your blood test will be slightly abnormal. You'll show FSH numbers to be very high, LH numbers to be very high, and your testosterone will be low. Often, the testis is small as well. Now, the next question people ask me is, why does this happen? Sadly, half the time, we can't find a reason. In the other half, if you do genetic testing, you will find things like Klinefelter syndrome, where you have XXY. You have people born with male factor. That means the Y chromosome, the one that makes us guys. There are defects on it that stop the production of sperm. Sometimes you could have had a bad infection that destroys the factory cells, or you had mumps as a child, which is very common. But usually this one you'll remember because it would have been incredibly painful testis. But short version, there is a problem with production. If it's something fixable, that means if it's, for example, a hormone related, then we try fixing the underlying issue. But for the vast majority, we need to do something to retrieve the sperm. And the best surgery, which TMC has, and I think we're one of the only centers in Malaysia that does have it, is microsurgery. So we do microsurgery extraction of sperm. It's called a micro TC. It's not so scary. We explore the testis. We look part by part until we find the sperm. So what happens is overall, there'll be most people are not so unfortunate. There will be one or two sperms still swimming around. We find them, we remove them. If you look for a slide, that's my operating team and that's my operating microscope. We collect the one or two sperms, we take it, and we inject it directly into the egg, a process called ICSI.
Sorry, Dr. Muhilan, your
Right.
slide is frozen actually.
I know I've not moved it.
Oh, okay.
Sorry, I'm still on the
Okay,
non-obstructive azo.
great.
So I put everything in one slide, so you're
Okay,
forced to listen to my voice.
no problem.
Okay. It's not pleasant as yours, but it's okay.
No, not
So
at all.
anyway,
I'm getting so much info already.
all right, cool. So basically, we collect the sperm. You get one or two good sperm. You take it, you inject it directly into the egg. You wait 3 to 5 days. Hopefully, you have embryo, which will have 3 to 5 cells. Put it back into your wife, and in about 6 to 12 weeks, you should have the picture I'm showing of this nice little baby. So that's the good thing, right? So the good news is we can help a lot of people, but in about half the people, we don't know what's going on. We can't find a reason. And in another half of my patients, I sometimes the surgery fails. So micro TC is the best option for non-obstructive azospermia. If I'm going too fast, if you need clarification, just send in your questions and I'll get to them at the end. Thank you. Right. Now, this one is you still have no sperm, but your factories are healthy. They're pumping out the sperm. They just don't come out of the testis. So this one, again, surgery is option. All right. Medication has no role. So basically what happens is the pipes are damaged. So the sperms are trapped. And the pipes get damaged. In Asians, it's usually due to infection. In Westerners, there's a congenital condition called cystic fibrosis, which goes down in families. And in the men, the tubes are missing. So it's not that tubes are blocked, they're just totally missing. So the success rate for this is over 90%. We find the sperm, we collect the eggs. So usually my colleagues at TMC Fertility and IVF Center, they will have the eggs on standby, collect the eggs, inject it in, straightforward, 90% success rate, you have a baby. All right. Now, so that's, well, the last two slides were for people who have zero sperm, all right? That means for whatever reason, there is no sperm in 2 samples where we have checked, either it's obstructive or non-obstructive. Now, most people, thankfully, don't fall into that category. They come and see me, they have semen, but it's poor quality. The sperm are not moving, the sperm are low in numbers, or the sperm shape looks horrible. So they don't look that nice torpedo shape. They look square. They have 2 heads, 2 tails, many things. Now, commonest reasons are environmental factors, like the air you breathe, pollution, the food you eat, insecticides, but it's chronic. It's been building up over years. Recurrent urine tract infections, drugs, alcohol. Alcohol, not so bad in moderation. Smoking. Strangely, the next one is temperature. If you wear tight underwear, tight clothes, that one has the biggest effect on sperm production. So the reason your testes hang outside your body, it's like radiating heat. It's like the radiator of your car. Its job is to get rid of heat. So wearing tight underwear totally defeats the process. So basically, the first step, check your sperm. Let's see if we can, and check your bloods and do a general examination and see if we can find the reason why your sperm quality is bad. If we can find the reason, most of the time, if we fix the underlying reason and we wait 3 months to 6 months, we should have some improvement in sperm quality. Now, why 3 months? Because there's a number that nobody can change. Only God can change this number. Sperm takes 72 days to grow. So if I give you medication, if I change your lifestyle, for you to see the result will take 3 months. That's the number you can't change. So what happens is we try to identify why you have poor quality sperm. We find it, we fix the reason, and hopefully you get good sperm. For those who have poor nutrition, you lack the vitamins or your hormones are unhealthy, we have special medications like HCG, FSH. These are hormones, plus the correct supplements like Profortil that works well. We combine it, we give it to you, we assess your sperm. So once we have sufficiently good sperm, you will have three choices. Depending on the health of your wife, you could try normal pregnancy, you could try normal improving your sexual life to have a normal pregnancy. You could do IUI, where if you have 5 million healthy sperm, we take it, wash it, inject it directly in, shortcut to the eggs, 30-40% success rate, you have babies. Or we try ICSI, we have 75% pregnancy rates. So the first step, identify the reason why you have unhealthy sperm, fix the reason, collect the sperm, put it into the egg and transfer it back in. This is probably the most complicated one to treat because there's no shortcuts. Surgery doesn't help. We got to fix you, we got to improve your health, and that takes time. And it requires you to be committed as well. Right, sorry, went backwards. Okay. Then there's this very interesting group of people where they're about 5% of my infertility practice, where you're healthy, your sperms are in excellent shape, your wife is healthy, your sex life is healthy, no babies. I really have no clue why this happens. I'm putting it down to the will of God. So what do we do for you? We will try our best to get you a baby, and we are very successful at it with very high success rates. The treatment is either IUI. We try that first if your wife and you are young enough, where we just inject the sperm in. If you get pregnant, healthy baby, good, stop. If let's say you fail, we would try IVF with PGT or PGS. Basically, what we do is we take the egg, we put in a sperm, let the baby grow to day 3, day 5. We check the genetics of the baby for anything hidden that we may have missed earlier to make sure it's a healthy baby. Put the baby in, and you most likely will have a healthy pregnancy. The caveat for this is, which is how many times you will try IUI, how many times you try IVF, would you or would you not do PGD? It's very much dependent on the health of your wife, your health, and any other underlying medical conditions. So that's sounds simple, but takes a bit of work as well. Now, I've kept it pretty simple. This is just a brief outline of the 3 or 4 common things you see with poor sperm or zero sperm. The point I'm trying to make is a large majority of people can be helped, and there's a lot we can do, and we've gotten pretty good at it. So if you have questions, you can either scan the barcode or just call me directly or visit my website, and we'll give you what information we can, and we'll help you to the best. When I say me, means me and my gynecology friends at TMC Fertility will be there to help you. So I think that's it. Giselle, are you there?
Yes, I'm still
Okay.
here.
All right. So I kept it simple so people don't get bored.
No, it's
All right.
fantastic.
Okay. So right. Right. So I'm back. So do you have any questions for me?
I do have a couple of interesting points that you mentioned.
Right.
Um, One, the number one is, I'd say I appreciate the honesty. Not so many doctors would come up and say, if you have, you have a healthy lifestyle and you have a healthy sex life and you're still young and you eat well, you exercise and do all these things, but you can't get pregnant. Well, kind of, we don't know what's the reason, but we will try to fix it. I think a lot of people out there would would not say that, or would try to identify a problem or say, no, maybe there's this problem, or would run a million tests.
Right.
Uh, but saying that, I think being straightforward and honest about it and saying, look, we can't identify a problem, but here are some solutions or alternatives that we can take, right?
Okay.
So that's a great point I think you've highlighted, and I think anyone out there would appreciate the straightforwardness and the honesty.
Thank you.
Number two, you've highlighted that sometimes when there are some issues with the sperm, it could be due to some infection, the low count of sperm, right? It could be
Right.
due to some sort of infection. Maybe you can elaborate some more, or what are the sources of these infections, how do these infections occur in men, and what can be the precautions that that men can take, perhaps when they're in a younger age, or how can they identify these kind of infections to try to avoid them, or if they see the signs of these kind of infections, they would immediately seek a doctor's opinion.
Right. So, I was sort of hoping you wouldn't ask that, because this is going to cause some trouble with nice married couples who immediately going to blame the husbands. When you're young, the commonest thing is otitis, viral infections, which nothing you can do, is usually comes from moms.
Okay.
As you get older, um, for guys, a lot of infections are sexually transmitted, right? So STDs, gonorrhea, chlamydia are the common ones. If you don't want to get it, don't have sex, which sort of sucks. Everybody wants to have sex. So use a condom, okay? But sadly, with this one, a lot of guys make this mistake, right? So we skip oral sex. We don't use a condom for oral sex, and we use condom for vaginal sex.
Yes.
STDs are transmitted by oral sex as well.
Yes.
So if you really, really want to be safe, don't have sex with anyone but your wife. Let's hope your wife is trustworthy. Sorry, just a joke there.
No, look,
But
we appreciate the honesty. It's we're here to try to educate people, and sometimes
right,
you have to break some sort of barriers for
right.
the message to be delivered.
So wait, so that's one. So condoms during oral and vaginal sex would protect you if you're promiscuous. Now, strangely, the commonest source of infection is actually from your partner, but it's not STD. It's normal bacteria. It's like E. coli, Klebsiella, and it comes from the vagina, usually from your wife. So what happens is your wife's vagina or your partner's vagina will have good bacteria, lactobacillus, huge amounts of them. Now, let's say she has used, she's been prescribed antibiotics, or she's used a vaginal wash product. The good bacteria tend to die, and you get colonization by bad bacteria from the skin and or from the anus or rectum. That's your Klebsiella and the E. coli. And if the numbers are high enough, and you go and have sex, you will pick up the infection. So, ladies, before you go and blame your husband for UTI, understand they could have just got it just from you, all right? And it's not an STD; it's just a normal infection.
Hmm.
So, because you're trying for baby, obviously you don't use a condom with your wife, okay? But for anything else, use a condom. For ladies, do not wash the vagina with Dettol or betadine or anything else. And a lot of people do, and I hate,
Really?
right? And I hate feminine hygiene products
Okay.
because it's a very old teaching to use antiseptics down there. I'll tell people just use water.
Okay.
It'll preserve your vaginal bacteria and make things healthy all around.
Okay.
All
So
right.
I think I would have a follow-up question on this. You've pointed out some great things.
Right.
Let's say let's say you've had an infection, let's say for someone who's trying to have a baby, right? For a
Right.
male, let's say the male had an infection before they got married or some time ago. Can that infection have a long-term effect on the sperm
All right.
count? Or
Right. So yes, it can. So in two ways.
mhm,
STDs like chlamydia and gonorrhea, both for male and women, they can block the reproductive tubes. So that's permanent, right? So if they have partially blocked the tubes, you get low counts. If they have totally blocked it, you get zero. But other infections can damage the Sertoli cells, the cells that produce sperm. They are incredibly sensitive.
mhm.
And if The effect is there, but there's no antibiotic is going to work. If the infection is long time ago, it would have done the damage, left scar tissue and gone off.
Okay.
And for the ladies who are worried, if the infection a long time ago, it's not going to transmit to you. So you don't have to worry about it.
Okay. Okay. Good.
Okay.
Okay. Well, still on the topic of infection.
Okay.
Let's say you have caught an infection.
Okay.
How would you identify it? Are there different types of infection that you can see that can manifest
Okay.
genitals?
So,
Yeah, go ahead.
right. So all infections, male and women, there are two. There's subclinical. Subclinical is you've got the bug. It's like our friendly COVID. You got the COVID, but you feel nothing, right? So you got STD or you got a urine tract infection. It's causing damage in your body a little bit at a time. It's blocking tubes. You have no symptoms. But unlike COVID, this one is 30%. COVID's about 70 odd percent, I think, that people get it and don't feel anything. Now, 70% of us will feel something. It's the degree to which you feel it.
Mhm.
The vast majority, the more than half, what you have is you get this, for guys, you get this vague discomfort in your testes. Urine feels a little bit hot. You go to pee a bit more often. That's it. Wait 2 days, 3 days, everything settles down. Drink more water. Most guys, they just like have some discomfort. It itches a bit. It's a bit uncomfortable, and they just leave it.
Okay.
But the infection is still there. It does cause damage, right? The ones that actually go to hospital is when very bad, when your testes are so swollen that you can't walk straight. Okay, can't wear your clothes,
That must
and
be.
when it is horribly painful. When you pee, it stings. It's like you get this burning sensation. It's like passing glass.
Okay.
A lot of women get this urine tract infections.
Yes, yes, yes.
Okay, so um, women are very familiar with it. And you tend to pee really, really often. So you get up so the commonest thing that bugs most people is you get up at night to pee. You go and pee, 1 hour later you go and pee in a small amounts of urine. Daytime you're running up and down to the bathroom. And for some reason, everyone's got this obsession with cranberry juice. So they start swallowing cranberry juice, which honestly doesn't work that well. But anyway, people like to do it. Any liquid should work at this stage. Then by day 3, they figure like it's not working and they show up my doorstep. So that's, if you look at the overall grand picture of things, that's about 10% of people who actually come for treatment.
Okay.
So 90% either didn't feel it, they had mild symptoms, and it settled on their own. But the damage is still there. That means the bacteria entered their body, it did cause damage, it's just they didn't feel it. All right. Did that answer your question?
Yes, yes, you
All right,
did
cool.
answer my question. Thank you. So
All
I
right.
think what I am getting from you, right? There are different types of male infertility, and then in terms of infection, there are different types of infection, and the way the person can get those infections vary, right? It's not vaginal sex only, but it's also oral sex. And
Right.
you've also mentioned that, if you do get an infection, go ahead and consult a doctor. Don't wait for it for too long, especially,
Okay.
if you're thinking of having children at one point. And B, don't assume that the person, that you're with is doing
Yeah.
something wrong. But
Yes.
actually, there are different types of liquid in the human body, and sometimes because females are using different vaginal cleansers, or different things that can affect
I,
the bacteria that they have. So your second point is females who are also trying to get pregnant, and stay away from any of these.
okay. So, okay, on a side note there, right? Because I treat a lot of infertility. Okay, this is for the women out there. Two things really don't work and don't help you. The first one is the feminine hygiene products. So a lot of women use it because they like to feel dry. You're not designed to be dry. You're designed to be wet so the sperm can swim. Sorry, put it that way. So if you feel dry and if you have pain during sex, the sperm chances are not going to swim. And if you have pain during sex all the time, you're not going to have that much sex. All right. So a lot of people who use feminine hygiene products, they have vaginal dryness and they have discomfort. And the good bacteria, the lactobacillus, need moisture to live. Sperm need moisture to swim, right?
Yes.
That's one. Um, the second thing that doesn't work for people trying for pregnancies. So a lot of my patients come to me for erectile dysfunction because the wives will tell them, it is now 3 p.m. My temperature is right. The day is right. We will have sex now. We are not machines, ladies. We do not work that way. I can guarantee you that is the day we are not going to work. We're not going to function, right? It does not work. Okay. So telling me that at 3 p.m. I have to perform, trust me, I'm not. Okay. The stress alone will make sure I don't perform. Okay. So what I'm trying to tell you is if you want to try for pregnancy, identify roughly what day you are. That's enough. So let's say day 12 or day 13. The sperm live for about 48 to 72 hours. The egg will live for 48 to 72 hours. So if you have sex the day before, 1, 2 days before, the sperm will still be alive and the egg pops out, right? So have sex every other day. So if you start, say you're ovulating on a Friday, have sex on Wednesday, Friday, Sunday. It's
Sunday.
fine. Okay. Don't try it. Time it. I guarantee it's not gonna. And I have so many couples coming with this. Okay. And the guys are all like,
The mental stress of, performing, and you feel that there's a task. I mean,
yes,
having being with your partner intimately it's not a task. It should not be by
yeah.
force. It should be more of a
It's
natural.
like doing work. Okay. If I want to do work, I stay at work. But seriously, as a human, okay, guys cannot do it, right? If you come and tell me, do it now, it's like, that's the day I guarantee I will not perform. Right? So, ladies, if you want to get pregnant, don't use vagina wash products. They're truly horrible, horrible products. And you don't need it. Your ancestors have lived without family hygiene products for literally thousands of years. Okay. You do not need it to be healthier. Water works perfectly fine. And please God, don't add the additional pressure of trying to time it, just to complicate things. Okay.
Okay,
All
sounds
right.
great. Thank you. I'm loving this discussion. I have one final note that you
And
have mentioned, which is, the male testicles and the male part is designed not to be compressed or not to be in heat. And
right.
as you mentioned, a lot of male are, they wear tight clothings or tight underwear. You did recommend to not wear tight underwear. However, for instance, in Malaysia, the weather is pretty hot and it's pretty humid, and
Okay.
sometimes when you're working, what are some of the things that one should do? Let's say you're
All
you're
right.
going out, you're wearing tight pants and you have to wear something a bit tight. What are the alternatives? What can you do? What would you recommend
Okay.
our
See,
friends out
you
there?
know, okay. So one, wash regularly, and honestly, like, just keep the underwear. So why do you wear tight? Okay. We Google people all the time anyway. So if you want to wear tight clothes, skip the underwear. It's it's not too bad. Nobody's going to stare at your crotch the whole day. Okay. All right. They might, but can think of it as a compliment. Okay. Uh, wear slightly looser shorts. I mean, come on. I'm interested in having a baby. So, it's designed to radiate heat. Our temperature is bad enough. If you're obese or you're a little bit on the bigger side and you wear tight clothing, it's even worse, right? So if you want a baby and you want to maintain your fertility, wear loose boxers with looser pants. If you want to look good, skip the underwear. If you want to wear underwear and still wear tight clothes, skip the baby.
Okay.
All
What
right,
okay, what
pick
about
one.
what about let's say gym clothes? Because a lot of men now wear tight pants in the gym. What do you recommend? Is there any specific
Okay,
material
so
they should avoid?
nah, nothing. But gym is like what, an hour a day, unless you're like a fanatic. But yeah, most guys an hour a day, 3 times a week.
Yes.
It's not a big difference.
Okay.
But this is more of a general rule. So you spend 8 hours sleeping, right? So wear loose shorts and sleep. You sleep more comfortably. You're 8 hours at work, wear loose pants. When you go out for a club or go out to a function, you wear tight clothes for an hour or two. It's not going to make a difference
Okay.
compared to 8 hours at work and 8 hours at bed,
Okay.
right?
Um, on that note, this has been
Okay.
extremely fun. I really
Okay.
enjoyed the session with you, Dr. Muhilan. It was a brief, nice session, and we
Um,
hope to have some more of these.
okay.
To anyone who's watching, you can scan Dr. Muhilan's QR code. He has a lot of information online, or you can contact him directly. We will also leave his contact details on our Facebook page. So, Dr. Muhilan, thank you so much for making the time. This was extremely fun and super
Thank you.
informative, and I'm sure our audience would love this discussion.
All right. Thank you,
Hope
Jiso.
to see you
Have
soon.
a good
Take
day.
care and stay safe. You too. Take care. Bye bye.
All right. Bye.